welcome everybody officially to the new academic year and the cluster events of 23-24. I'm very happy to be able to continue the cluster even after David and Peter have left to go back to their new and old universities at the EUI, because what we saw in the call, in the replies and response to the call of interest, expression of interest, was that there is a lot of research going on here at our institute that is absolutely worth focusing on, and thus switching a bit the approach to the cluster that we had over the past years. So previously, given that we had an ongoing crisis with the COVID pandemic to monitor and analyze, we focused the previous years and the presentations a bit more on these. And we've seen here and in the preparatory talks to this year's agenda, what also came out was that a lot of research was inspired due to the events that globally have put the focus and shed more light on science advice and policymaking, and that it would be a very good moment for us to take stock of what is here and to give researchers, academics, and scientists at the EUI the chance to present their research, but also, and that's a second point, to focus not only on presenting results, but to move on and discuss jointly what type of interdisciplinary methodology could benefit the analysis of science policy interactions. And this is a part of the learning objective of this year, that we, in our presentations, discuss your research results, but also the approaches to your research. So what was methodologically important? Where do you sense there was room for improvement, discussion, and how interdisciplinarity can help us really to analyze the blind spots or the less operationalizable elements of science policy interaction, so the less tangible moments. So this will be a strong focus, and we will leave a lot room for the end of the semester to discuss what we will take stock of during the presentations, and Mira will help us here to make sense of that discussion on methodology and how to approach academically the research field. A bit of stock taking for you to understand where we are. We had 81 replies to our call of interest for participation. So the cluster has now grown to 81 participants, who obviously can't always join every activity, but just for you to understand that there is a critical community has emerged here at the EUI, and that there's a lot of opportunity to exchange on your own research. We will this year leave it to the discretion of the presenters whether or not we record the presentations. And this is due to the fact that while some present existing and published research, some might want to present ongoing research, and therefore we think it's better for the presenters to decide if we would be able to record and put the presentation on the website. So in this case, I think Diane and Anneke, I hope so too. Is it okay for you if we record the meeting, or yeah? Great, thank you very much. And with that reply, I'm actually very happy that we have two very eminent colleagues who for a long time already focused their research on the essential questions, not only of science policy interaction and expertise in public policy, but also to questions of institutionalization and of questions of public engagement beyond public institutions, so public-private interaction, which is an extremely important area, potentially gray zone, if we think of co-creation of knowledge for public good. And in that sense, Diane, who's full professor at the School of Transnational Governance with the chair in public policy, and Anneke, who is an adjunct associate professor at the Center of Policy Futures, Queensland University, are talking today about one of their most recent publications and shedding exactly light on these questions and these interlinkages of institutionalization, knowledge creation, and the potential impact of different qualities of knowledge deriving from this global governance moments of institutionalization of science policy interactions on the impact of during the COVID crisis of science advice in public policy. Over to you. Thank you very much for opening up our academic year.
Okay, it's a pleasure. It's wonderful to be back here in the cluster, and very good to hear that it's growing as well in size and interest. As Gabby has mentioned, this is a recently published paper, about 6 weeks old now, I think. It's a COVID paper, not solely in terms of its subject matter. It's also a COVID paper in that Anneke and I wrote it without ever having met each other in person. So it's a serendipitous paper as well. Yes, we did actually meet for the second time about 10 days ago, where we sort of very quickly went over the paper and what we were going to present today. So let me just say I am simply here on the title slide. Anneke will take over pretty much from here to describe her own background and how we came about this particular paper through our joint interaction on one of the commissions that we talk about in this paper. And then I will cover the last half of this session, looking at some of these issues of institutionalization, but also generalizability as well. Yeah, but at this point, I think it's best if I hand over to Anneke.
Thanks, Diane, and welcome everybody. And this is my first presentation to your group. And as Diane said, we met 2 or more years ago now, Diane. And my favourite moment with Diane was realising I was having a fan moment online, realising Diane was the person I'd quoted extensively through my PhD, and there she was on the other end of a Zoom call. So I was pretty excited to meet her and to meet her in person. So we've maintained, I think, a good discussion across these years now about the connection of knowledge and research and innovation to global policy. And to that end, this paper is really an expression of that common interest between us. Last week I was at the EUI and we were talking similarly in a presentation about my work with global health policy in particular, and the UHC, or Universal Health Coverage Action Agenda, which had just been published, and how it used social science frameworks like Kingdom's frameworks to shape and guide the way that the policy framework was developed. And so this week, looking at a different aspect of how policy is shaped, but still, just as focused on, how knowledge and research are presented into global policy processes. And again, this is being focused on global health policy during the pandemic. So if I could have the next slide, I'll start. I'm going to cover some of the method and framework for our paper, and then Diane is going to pick up on the analysis, and then we're hoping actually to focus mostly on having a good discussion with everybody after the end of it. So just to start, our approach was really, grounded in our exposure to one of the commissions, in particular the Resilience Commission, but I've worked with other commissions like Commission for Information and Accountability at WHO a few years ago, and come from an Australian background where we have a very rich tradition of influential commissions shaping public policy in Australia. So this really came from that really common interest between Diane and I. We selected 4 commissions for this. One was a regional commission, the WHO commission, the Monti Commission it was called, commissioned by WHO Europe. And then 3 global commissions, the Independent Panel, which is, the Helen Clark and Ellen Sirleaf Johnson panel that has been, discussed extensively, I think, at global level. And then two lesser known commissions. One was the Sachs Commission, which was a Lancet commission, and the other was the Resilience Commission, which was a public-private commission. These four commissions were convened specifically to address the pandemic, different aspects of their analysis, and their membership funding and other resources were drawn from more than one country, so they had some common criteria. We excluded, there was a plethora of national commissions, you'll probably know some yourselves, and other gatherings, conferences and events, and the Global Health Security Conference and the World Health Assembly, they were excluded from our analysis simply because they're very different constructs. If I could have the next slide. Thanks. So just wanted to start with some definition about global policy making. And here we focused on global policy as being transnational, public administration, and global policy process being focused on the design, delivery, and implementation of global policy tasks. This is a very generic definition. There are lots of debates about whether it's linear or circular or chaotic, or there's three streams, which was what Kingdom would propose, and we just took a simple view that there's some common steps. They may not always necessarily be sequential, but there's common steps in this process. And within this context of global policy, commissions are an example of a tool that is trying to bring together this patchwork of disjointed and fragmented global policy making. And for global health, there's a strong and persistent narrative over a very long period of time now that it has become very disjointed and fragmented in its policy making, hence its challenges when we get hit with global health emergencies, for example, like Ebola. And just to say there, I did actually work inside WHO during the Ebola outbreak and experienced it from within the organisation, which was quite interesting as well. If I could have the next slide. So this is our definition that we've used in the paper on global commissions of inquiry. They are independent by our definition. In the main, they're ad hoc and temporary, although some examples of global commissions are more permanent, like the IPCC. They are designed to gather evidence and make recommendations, and they're generally not involved in decision-making or policy implementation. So they are attached to global policy processes, and they seek to influence through use of evidence and provision of knowledge those global policy processes. And finally, they're sites of sense making, and they provide an institutional forum for a combination of public input, also private input in our experience, alongside other expert advice. And this is particularly relevant for the global health policy arena because there is a strong reliance on public input into global health policy processes through the World Health Assembly and so on. And there is room for expert advice and particularly scientific advice alongside that. So if I could have the next slide. Wicked Problems. This book was released last year by Brian Head. There's obviously a lot of literature on wicked problems. But some examples here over time of global commissions that have sought to address some of these wicked problems. The Brundtland Commission, for example, has been really had a long-standing influential role in global policy, particularly the International Commission on Intervention in State Sovereignty is another one, and then cases of commissions on child sexual abuse in international care as well. There are a lot of global commissions, and of course these are also accompanied by a probably fivefold number of national commissions as well, just to highlight that they're playing a role at global level, also national level, and that was the purpose of our paper, was to really understand what did this mean in the health context. So if I could have the next slide. And I guess a key challenge to this end from a global commission viewpoint is their authority. How do they determine their authority in the global realm, given that it's quite a different realm to the national realm where you're talking, sovereign laws, and you're talking, direct policy influence and democratic processes. I guess the question for global commissions is, well, what is their authority? what is their mandate in terms of addressing complex global challenges, and how do they connect to those policy processes. And part of the authority we know for these commissions comes from the individuals that sit on them. Diane often uses the term vanity projects, which I quite liked. But during the pandemic, I think we saw not only the political element of their membership, but also the scientific and other people, keen to contribute to addressing the wicked problem at hand. The galaxy of experts, as we've put there. So if I could have the next slide, which I'm hoping is my last one. No, it's not. So these are the 4 commissions that we chose, and just a little bit about their construct here. The Independent Panel for Pandemic Preparedness and Response was commissioned by the World Health Organization, chaired by Helen Clark, who's a former Prime Minister of New Zealand, and she was also the head of the UN Development Programme for a long time. And Ellen Sirleaf Johnson is the former President of Liberia. There was a regional commission, commissioned very early, actually, I think within months of the pandemic emerging. Mario Monti had been appointed as the head of a commission at the European Office of the World Health Organization. So 2 officially sanctioned and commissioned commissions that we've got there. The Reform for Resilience Commission that I mentioned previously, where Diane and I met, was formed by a British MP, had university hubs, including the European University Institute for Time, was chaired by Jose Manuel Barroso, who's now the chair of Gavi, and Malcolm Turnbull, former Prime Minister of Australia, and Michelle Williams, the Dean of Harvard Public Health at the time. And then finally, the Lancet COVID Commission was commissioned by the Lancet. They have a platform where they host a lot of commissions on different health topics, usually more recently on environmental and health topics. This one was chaired by Jeffrey Sachs, who's a very eminent economist, an American economist. So these were the 4 that we selected for our review. If I could have the next slide. There, that's my last slide. So the framework that we used for this was to consider their legitimacy and, pose the question, whether legitimacy was crucial to the COVID Commission's current and long-term relevance. So there we looked at input legitimacy, which looks at things like the authorising actors, the standing of the people on those commissions as well, and then the question of their representativeness and their elite composition. Second, we looked at process legitimacy. As a former statistician, I can tell you methodology is very important. And here we looked at how they collected their data and evidence, their academic freedom and independence, or their image of independence. And then finally, outcome legitimacy. We looked at their reports and publications. You might call this policy tracing, which is not a bad way to go when you're looking at how commissions influence public policy. Global public policy at this point, and how they influence decision-making, policy, practice, or the sense-making related to, particularly in this case, the COVID-19 pandemic. So with that, I'll hand over to Diane. Okay. She can hopefully continue with the slides.
Yes. Okay, thank you, Anneke. I think we also need to confess, in a way. We had 4 commissions to review, and frankly, in an 8,000-word paper, we didn't even cover half the territory that we could have. But we missed the G20 high-level independent panel, which was commissioned by the political figures, state leaders associated with the G20. It came a little bit later, and I think that was one reason why we didn't notice it. But it was also quite interesting, I think, this particular panel, because even though we looked at it later, it pretty much confirmed the kind of findings that we had, and more importantly, the kind of recommendations and assumptions, even though this particular panel and report was focusing on the economics and on the financing, it was very much complementary to the other kinds of commissions that were in operation. So the title of our paper was a clutter or a chorus. And I think what we could say is that the commissions that we looked at were very much a chorus. They might be singing in slightly different voices, but they were very much complementary and largely confirmed each other, which makes me think now at this point that that is part of the point of these international commissions, that as a mechanism or as a tool, even though there is a plurality of them, and as I'll come to when I come to the criticisms, you know, you can ask this question about duplication. Nevertheless, I think what political leaders and other statespeople can say is, well, look, there's the international consensus. We have these 5 or half dozen or more global commissions pretty much saying the same thing when they look at the evidence, but coming from quite different starting points in the nature of their questions that they're asking, and the approaches or lens that they might be adopting in the process. I think one of the definitional things, I mean, we have a definition that we drew upon other definitions, mostly focused on UN commissions, as in order to develop our definition of global commissions. But having said that, I think there were some difficulties in trying to draw a clear boundary between commissions and other types of mechanisms that are also in operation. And one of the problems I think that comes with definition is that there tends to be a view that independent commissions, global commissions, high-level panels, task force, whatever they're called, and they go by a variety of different names. There is an assumption that there is a sunset clause associated with them, that these are not permanent entities, okay? Having said that, however, we have found a couple of examples of commissions that have persisted and institutionalized, if you like, because of the nature of their work. They found a target audience, but also donors to continue the work of the commission as well. And something that also emerged today for me when I was going back over some previous material is that there can be a connected trilogy of a commission. So I'll come to that in a moment when I put up another example. And then there are 2 more that we excluded. The Madrid Club, which is an informal club of former presidents and prime ministers. It's an NGO, a non-state actor. They also had their commission. But my very strong suspicion here is that they actually started a commission on democracy, all right? And the COVID situation came along and they tacked on emergencies in order to make this particular commission more relevant. And then there was also a Vatican commission, and frankly, I just couldn't find enough information on it. And I still, even when I looked at it yesterday, I still don't know who was on it. So we left that one out of the frame. But they did produce some interesting fact sheets and reports. Now, when I went through them again, I would say it's another case that much of what was being done in that commission was supporting of the work of the other kinds of commission. Okay, so
Sorry, I think there's an audio problem. We lost you.
Okay, thank you, Laura. Thank you for that. Should I start with health commissions? Yeah. Okay, so the global COVID commissions that we looked at are part of a wider population of health commissions at a regional level or international level. The Lancet has adopted as its usual business of producing or creating a commission on a very specific health topic, virtually one a year. And they're just some of recent examples there on this slide. Anneke has already mentioned that there was not just one Ebola commissions, but actually 4 Ebola commissions. These were all, I think, commissioned through UN agencies. So just to make, before I go on to the more general point that I want to make, the Lancet commissions are more private sector, if you like. The Ebola commissions are more official. So this is what we mean when we talk about different authorizing environments for the creation of different kinds of global or international commissions. So in the paper, one of the things that we did on the basis of looking at our 4 case study organizations in the light of the more general literature on international or global commissions was try to distinguish between different types or different species of commission, for want of a different word. And I think the top one, official global commissions, is the one that we're most familiar with. The kind of commission or mechanism that is established by an international organization, whether it's a WHO or another international organization, or by a government or a group of governments to establish an official global commission. So this is one that has the greatest degree of political patronage and support behind it. The Lancet Commission is that style of commission is an example of what we've decided to call an epistemic style global commission. It's not one that's been brought into existence by political leaders or governments or international organizations. Instead, this is a kind of commission that has been created by the scientific community or a university or groups of researchers that have come together to address a pressing global concern or global problem. And this is not just within the area of health, but I think you also see it in the area of environment as well, a proliferation of these kinds of epistemic style global commissions. And then the final type of commission in which we would put the Resilience Commission, the one that we were associated with, is more mixed. It might have public actors in it, but it also has other kinds of experts, by which I mean experts in the broadest sense of the term, experts who might have an understanding of the workings of the global system due to their bureaucratic experience or their experience in philanthropic funding or community engagement, whatever it might be. So different kinds of expertise is brought into these civic style global commissions that are more civil society based, if you like. So you have a much more mixed nature of composition in a civic style global commission. And as I said, the Reform for Resilience Commission that Anneke and I were connected with was very much in this style, because it was initiated by, admittedly, a politician, but one acting in his private capacity. who was very concerned to bring in a business perspective on how to build resilience in the workforce in pandemics and other kinds of emergencies. Now, even though these are 3 bullet-pointed types, I would also stress that there is some fluidity between the types. In order to build legitimacy, the official global commissions do bring in scientific experts for this, precisely because they have expertise, but they also often bring in community leaders as well to in order to try and develop better representativeness of commissions. So these are the 3 types of commission. And one other thing I would probably say is that the epistemic style commission and the civic style commission are a newer breed, okay? They've developed from or mimicked the style of the older, more traditional official global commission that is established by government or international organization. So the criticisms of commissions. The criticisms are bound, okay? There are many types of criticisms. There is a kind of critical perspective that would sometimes from a neo-Marxist or neo-Gramscian perspective to argue that these kinds of global commissions are kind of like the tip of the iceberg of a global managerial class, or that these commissions are composed of the great and the good and reflect that old boy style of club diplomacy, that there are elite projects designed to help bolster the existing system, albeit with a little bit of tinkering through the kinds of recommendations that may come from commissions. So this first type of criticism accords considerable influence to commissions in upholding the neoliberal economic order or existing structures of power. But another perspective is that, well, these commissions are not really influential at all. They're just talking shops, okay? They're just, yes, as my favorite term, they're vanity projects for politicians out of office who have retired and need something to do. Maybe that's a bit harsh, but if we're going to go that particular direction in the types of criticisms that are leveled at commissions, it is a view that sees them as being not very influential. Another criticism is the depoliticization argument, and that these commissions are devices or tools to deal with the kind of deeply contested issues on which there is no consensus, or consensus is very difficult to find for politicians to find. So it's commissions represent a tool to displace the investigation of an issue to a safe area of discussion. You take the politics out of it, you take it away from partisan politics or away from opinion leaders on radio who are pushing one particular perspective, and give it to a group of people reflective of the community in some way, or who have expertise in the area to deal with that particular concern, away from public attention, away from the politicized nature of debate. And here I would talk about the commissions of inquiry into child sexual abuse. These were issues that politicians found very, very difficult to deal with. And while these are examples of national level commissions that were seen in Canada, Australia, New Zealand, and elsewhere, nevertheless, it was internationalized in a way in that the template of the Commission model was used in all these Anglophone countries to deal with this particular issue, which was a hot political one in those particular countries. And then this would then come to a way of saying that these commissions can be effective deliberative bodies in the sense that they create a space for relevant members of the community to deal with issues that are otherwise very difficult to deal with through the usual routes of representation. I think I've dealt with the other points in the sense of commissions being seen as elitist and only coming up with reformist approaches to deal with problems rather than being entities to shift paradigms. Here, though, I think it's necessary to take a temporal view. A commission may not be influential in the first year or 2 or 3 years of its existence. But if you look back at the Brundtland Commission, it was slow burn. Its role in raising consciousness and changing the lens through which environmental problems were viewed was quite important over the long term. By no means was it the only actor, but certainly it was a very important one in the past, and its perspectives continue to resonate. But finally, going to the last bullet point, how many commissions do we need? Okay, are these commissions actually a useful tool, or are they overused? Is the duplication and fragmentation because there are so many different bodies trying to angle to get their particular perspective or report into public attention and into policy fora and decision making, that it can have some counterproductive impacts. So there's some of the criticisms and 1 or 2 favourable points regarding commissions. The other thing also is that in this paper, we decided to use Vivian Schmidt's notions of input process and output legitimacy, but that is only one frame of analysis. There are many other ways, I think, of looking at this type of tool or mechanism for taking forward expertise and research and analysis that could have been adopted. And Anneke mentioned a couple of times John Kingdon's approach of multiple streams and windows of opportunity and the role of policy entrepreneurs. And clearly with global commissions, the role of individuals can be quite important in this process. So the multiple streams approach would have been another way in which we could have taken forward this analysis, and might do in another paper perhaps, but it is an agency-driven explanation or framework of analysis. By contrast, there is the institutionalist approach of a global knowledge regime. And this argues that there are different types of knowledge regimes. It's a comparative approach of different types of knowledge regimes for the uptake and use of evidence that differs between countries like France, Germany, the United States, and other concepts. So it would probably be necessary to develop a regime perspective at the global level as well, in between the different kinds of institutions, international institutions that would exist. Similar to that, to the institutionalist approach, there is the policy advisory systems approach that has been developed in Westminster systems. And that particular approach I put here because it automatically takes you to commissions of inquiry, because they're predominant in Anglophone systems and Westminster systems. I don't think I've got quite enough time to go through the other approaches, but let me say there is plenty of analytical frameworks, I think, through which it is possible to view commissions of inquiry. So to conclude, we think global commissions are really, really interesting because they are evolving in their format. And also, if you give credence to the notion of transnational governance, which I have to, given my institutional location, and also that there are global policy processes, then, you know, looking at the devices of global policy making, commissions are one of the tools in the toolbox. The issue of their influence, I think, is something that really needs to be investigated much more closely, and in particular, whether they're a useful adornment of being seen to be doing something, but not necessarily being heard. Because really, what happens after they've made their recommendations? Are they picked up? And I put a picture up there of the UNESCO report on education. Well, it was kind of wiped out by COVID. It reported at the beginning of the COVID pandemic, and nobody was taking terribly much attention to it. But having said that, the commissions are a good way of bringing together different kinds of stakeholder expertise to deliberate on an issue of societal or economic importance. And I have up there that they are a rapid deployment device. They are actually a mechanism that can be created very, very quickly. Their deliberations might take a long time, but the actual creation of these bodies can be quite quick. And as I think Anneke was saying, it is crucial, and I think this is one thing that I hope our paper stresses and conveys well, is that the independence of these commissions and their subsequent influence is crucial, and they need to pay very close attention to how they collect their evidence, the methodologies they employ, and the representatives that they bring into the framework of the commission as well. So potentially for future research, it'd be interesting to see whether our idea of these three types of commission holds, whether it gels and resonates with other actors. The Futures of Education Commission, the UNESCO Commission, is an official commission, but the current Global Commission on the Economics of Water is not. Okay. And this I mentioned earlier, it's kind of quasi-official. And I think this is what's interesting. I mentioned earlier that there are a trilogy of commissions. This is the third and last one, the Global Commission on the Economics of Water. The first one was the Stern Review on Climate. That was commissioned by the UK government. The second commission on, I think it was review panel, they called it. The review panel on biodiversity was also commissioned by the British government. But this third one was commissioned by the government of the Netherlands, and it's now hosted by the OECD. Okay, so it operates independently of the OECD, but is hosted. So it has some of these hybrid qualities. The high-level panel for the ocean economy, that is also hybrid in a different way, in that 18 heads of state have signed up. No, sorry, let me rephrase that. 18 heads of government have signed up to support the Ocean Commission, but it is actually more of an independent body. And then even more private, our third category of civic style would be these two, the Global Commission on Evidence, interesting title, but it is civil society based, as is IPSP, which is a body I have recently joined as well. And the challenge certainly for IPSP is establishing its authority and getting heard, because basically it's just a community of concerned social scientists and representatives of NGOs. So I think there is a lot more to do on commissions, and maybe one day we'll see one here in Florence. And on that note, I will conclude and look forward to some questions.
Can I just add something in, Diane? Yes, sorry, I can't hear.
Anneke, what did you say?
Can I just add something in, just to end?
Sure.
So something Diane touched on before for everybody, that, 3,000 words was not enough. I think the area that we haven't really gone into in this paper, but obviously exists, is alluded to in the title of our paper, and in some elements of the paper we refer to fragmentation, and that's power and knowledge. I mean, to that end, I'm just going to hold up Diane's book here, which, there we are. If you get a chance to read that particular book, it talks a lot about epistemic communities, competition, power, dynamics between them. We couldn't get a chance to go into this in our paper, but I think that's another very fruitful area of future discussion. And just in the global health world, we know that there's competition and fragmentation, particularly between epistemic communities. This is sometimes described as vibrant and pluralistic. Others describe it as chaotic. And David Fiedler, I think in 2007, famously described it as open source anarchy. So I guess from the point of view of our paper, we were looking at the role of commissions in some ways bringing together this very competitive and fragmented environment, and was there a useful role in doing that? But there is also then the power of how that knowledge is used. So just to end on that note, perhaps for discussion.
Great, thanks a lot, Anneke, and thanks to both of you for the very rich presentation. And I've actually noted a lot of questions, but don't want to matronize. I see, Fabrizio, you're first, and then online, I'm going to need to move to the computer to see who raised your hand. So maybe if you want to come in and present your questions or remarks and comments, just give me a second then to move. Or Mira, yeah, great, thank you very much.
Thank you very much, Gabby. And just to introduce myself again, I am Federico Fabbrini. I am a law professor at the City University in Dublin, and currently a fellow here at the Robert Schuman Center. And I was a PhD student here at EUI many years ago. Now I'm interested in this because I'm part of the leadership team of our Horizon Europe project that is called Regroup, which also involves the Schuman Center, among others. And Regroup is a project that focuses on the resilience of democracies during the COVID-19 pandemic. And as a lawyer, I'm obviously in charge of the work package on the legal and constitutional issues. So I've been doing research with my team over the last year and a half, specifically focusing on judicial review of COVID-19 restrictive measures in constitutional democracies. And we did something that lawyers don't do that often, which is empirical large N studies. So there is a paper that I'm happy to share also with you. It's online, where I built a data set of over 300 court cases from Europe and the United States reviewing exercising judicial review of COVID-19 restrictive measures, from lockdowns to church closures, stay-at-home orders, up to face mask obligations or vaccine mandates. And basically, in a nutshell, the conclusion of this large transatlantic comparative study is that European courts have been extremely differential to experts and have, all in all, almost always upheld the COVID measures that were challenged in court. by doing reference, and here is, I think, your work comes in very interestingly. I didn't know it before, but I'll look it up, Diane. Very often by making reference to the outcome of these global commissions, including the Lancet. For example, the European Court of Justice cites the Lancet. And, you know, as an EU lawyer, I can absolutely tell you the Court of Justice hardly ever cites anything which is not a legal provision, but it happily refers to scientific publication in the Lancet to say, yes, it's absolutely fine to uphold vaccine mandates because the epistemic community tells us that's correct. On the contrary, on the US side, it's extremely interesting how courts have been much more willing to second guess public health policymakers. And in a greater number of cases, they ended up striking down those measures as being in breach of constitutional rights. And of course, as you know, in the US, you have dissenting and concurring opinions, so it's also easier to see how courts are reasoning and why they come to that conclusion. And very often the argument is those decisions are based on the opinion of experts, and we don't know who they are, and they are not legitimate. So in a sense, and sorry for making this so long, but I thought it was probably right to give you my background onto this, but I found extremely interesting your slide where you were drawing from Vivian Schmidt, input, throughput, and output, because I think the European perspective is to look at the output of this commission and to say, that's great. Those are experts. We like what they're saying, and we use that to uphold COVID-19 measures. Whereas the American approach is to look at the input and to say, this is illegitimate. They are not democratically based, and you know they go against the logic of we the people, where every decision has to be legitimated by sort of the democratic process. And so, yeah, this is just to highlight what we reached in our research. And of course, it's a lawyer's stuff, but I think it interplays here in a very interdisciplinary way with your work. But based on this, my question to really is, since you, at the end of the paper, you were sort of making almost a pitch, or certainly a plea to use more those type of institutions. And so in light of the criticism, which I personally don't share, but certainly it's something that is there and has to be reckoned with, that you have, particularly in the United States, those type of institutions are undemocratic. How would you go about it moving forward? What can you do to sort of retrofit or strengthen the input legitimacy of these bodies to make them acceptable? And my sense is probably there's no way we can convince the US Supreme Court now about it. I mean, they're just against the administrative state, the domestic one, try to guess the international one. But I think this is an issue that it's there because, you know, pandemic resilience will require some of that. So sorry for the long question, but thanks again for the great.
No, thank you. I really appreciate your comments because it made me think, and I'm just trying to go back with the slides, and I think because of the end of the presentation, it's just not going back. But where I had the frames of analysis, the way, go back a bit more, when you were talking about how it's different in the United States as opposed to a number of European contexts, I would put that kind of analysis within an institutionalist perspective because of the way in which rights are understood is quite different, and different legal traditions and whatnot shapes how knowledge is used or not, or respected or not. So it means then if you were going to retrofit, you probably have to do it differently for each context, because of the different institutional structures in which it's based, because you're responding to different expectations, I would say. And I think part of the problem with global commissions in particular is that not much thought is given to their design. They're thrown together, certainly in the COVID commissions that we looked at, they were thrown together very, very quickly. And had there been better thinking about who should be represented, what kind of expertise, and in particular, this was a lot of the stuff that we had to cut out of the paper, and Anneke in particular was pushing this, I would say more than me, but I'm not saying I was opposed to it. It's just that the communication side of it, you know, the fact that these bodies are seen as elite entities without thinking about the kind of public communication strategies and who who their not audiences are, but real stakeholders are, and adapting communication strategies that are much more nuanced, rather than focusing, particularly in the case of the official commissions, on who commissioned them. Okay, so it's the rather narrow looking focus on who the reports and recommendations are directed towards, rather than thinking in a broader sense of at an earlier stage about representativeness. I don't know if Anneke wants to come in here at this point, but it looks or not. Maybe not. One more thing, it's interest, Anneke? Yeah.
Yeah, sorry, I've just logged out for a minute. I'm not sure what happened, and I hope you can hear me. Can I just add to the question? I think you've identified a real challenge for global policy generally, which is there's a gap between, you know, what's agreed at international level or what's put to the international level, and then how that's implemented in countries. So you're right, I think, to query the legitimacy of global commissions, particularly the ones that are not official. But remembering also that, you know, these commissions, the work of some of these commissions is actually recognized in and agreed to in some respects in what we would call global policy. And these global policies generally have, you know, an agreement that that nations will implement particular elements of it, and then that global organizations will implement another aspect of that policy. So tracing it through those processes, I think, is important. And of course, you know, you get to national level and generally not often they're fully implemented. And that would be the entire experience of the pandemic, in my view, that we found where those policies were weak in their implementation. We also found where there was really significant policy gaps. And your work now continues with that, with the notion of, you know, well, where is this policy legitimate and in our national context? I think that's an important question.
There's one word you used. We were almost making a pitch for more of these organizations. Yes and no. I think these types of instruments are proliferating. I think there is some evidence of that. But I think one of the things that we did canvass in the paper was the problematic of the lack of permanence of these commissions, and whether or not that is a problem, and whether there should be the establishment of longer term commissions or permanent commissions. An example of a private commission would be the Global Commission on Drug Policy, which is fortunate to have very, very solid philanthropic support. And also because it dramatically it was the spearhead for the reassessment of drug policies that criminalized drug users, and it advocates a harm reduction response because it has that very clear oppositionary stance. It gave the Commission a longer term meaning for existence in order to carry that kind of work. So that particular body has institutionalized, which makes me think, is it actually a commission still, or has it evolved into some other kind of permanent NGO of a kind? But it's interesting that it deliberately mimics, and it says so in some of its early documentation, it deliberately mimics the UN style of commission in order to give it some sort of legitimacy, borrowed legitimacy.
Sorry, Diane, can I just make a final point on this, because it's such a good one? The question is also what would exist in the absence of these commissions, and the commissions themselves, at least, you know, are open and transparent in their publication of things, if not always so in their representativeness, you know, and how they take in their information. In the absence of a commission structure, permanent or not. Then there's the question about how those epistemic communities, influence policy at national or international level, and the answer there is probably that they're hidden, or more hidden than what you would expect to see when there's a commission in place. So, there's some pros and cons, I think, which we've highlighted. My concern in writing the paper was indeed the representativeness of some of the knowledge processes that go into global policy, how they're influenced. And I think that what your work is showing actually is that where there's an open process, it can be at least critiqued. Where there's a hidden process, that's much harder to do. Okay, maybe we should move on.
Actually, half. So I have Marina on my list, but I have myself. There's Costanza. I actually had a follow-up question on that because it relates. Sorry for taking the floor. It relates exactly, and you were spot on, Federico, on what I wanted to say: legitimacy and the different markers for legitimacy. So, if my question was, is there a hierarchy in between these markers, input, process, and output, which it seems yes. And then comes a bit the frustration here. What about process? Isn't that the overall meaning of a commission for something, for anything in the global process? To not create, but to identify the evidence that is important for the policy development in the given moment and field. So what about that in terms of the legitimacy and the correlation to uptake of the results of a commission's work? Am I frustrated by that now?
I think you should be. Absolutely. I'm going to make an observation from a global health point of view here at the moment. If you look at most of the resolutions of the World Health Assembly, by and large, they will refer to previous resolutions. It's very rare that they actually refer to any form of contemporary research. How they're taken up in policy, how policy and resolutions are influenced is a key question. And I think some of our commissions would actually ask that same question. Have we had any influence at all anywhere that's observable? I mean, the IPPR arguably is recognisable, but still, in our paper, we talk about the fact that they've had to follow up their initial report 3 times with warnings about, what are you doing? Where is this going? They are not seeing their own uptake in global policy processes. So I think it's a real question. I don't know whether, Diane, you've got any more observations on that.
It's a sad realist perspective on the world affairs, isn't it? And one that I 99% agree with, but I think we need to make a distinction between impact and influence, and short-term impacts and long-term influence. And I don't think there will actually be long-term influence from the 4 commissions that we looked at, but I think they were part of the weft and weave of the body of evidence and analysis that was created about the COVID pandemic. So in and of themselves, I think that's focusing too much on one entity to have impact, but to look at the overall part that they played in developing understanding of the COVID pandemic is important. So to see them as a cog in the machinery is still a way to see them as having relevance as part of a bigger project, if you like. But of course, newspapers and stakeholders and donors want to see impact, and that drives our attention when actually maybe we should question that desire for immediate impact.
Thanks a lot. So I now have Costanza, Marina. Okay, but am I overseeing someone, overlooking? Good. Costanza, please.
Hello, good afternoon. Thank you for the presentation and also for the interesting series of discussions that you have set out. So I have a question which is very much I want to open the discussion, and possibly this is something you are only marginally interested in, but it's very interesting to me, so I'm going to ask it nonetheless. So, and it doesn't have to do that much on global commission, but with commissions at different levels, especially national. I was wondering if you have been looking at this phenomenon, at this kind of let's say institution, let's call it, in parallel with other developments that are completely on the other end of the spectrum, like the mushrooming of institutes of participatory and deliberative democracy, which are, you know, to me, the complete opposite, and which have obviously completely different forms of legitimacy. And I was also wondering whether you saw a possible interaction within these two forms of, let's call them forms of governance or policy producing environments. I think Federico is there. I'm not sure I got it right, but I think that in the elaboration of the question of the Irish referendum on abortion, there was a sort of interaction in between a participatory deliberative assembly and some experts. I don't know if they were united in a commission. And I was wondering whether that could be a framework of interaction in between the two. That was
it was a citizen assembly, huh? It was a citizen assembly, Costanza, not a commission.
Exactly, but I was wondering, because I thought that the citizens assembly was informed by a commission of experts or by a series of experts intervention. So I was wondering whether you could see, as people working on this, a virtuous interaction in between these two different forms of
Yes, it's a really interesting question. And I think some of the recent global commissions have recognized that this is their Achilles heel, if you like. But because they're global, they're also so much more distant from citizens. And of course, there are no such things as global citizens. There might be a sentiment of it, but there's no reality of it. So these are very problematic bodies in terms of deliberation for things like citizens' juries, citizens' assemblies. But I don't think that means that these bodies can't think about it, okay?
Yeah.
What the IPPR did, not the the Sirleaf, Johnson and Helen Clark panel did, is they had town halls, okay? So they moved around from various contexts, countries and regions to others to take in reflections, evidence from communities around the world. But having said that, I wouldn't say they were able to get to a broader expanse of the community. Those that they would have consulted with would have had some epistemic credentials of some kind or political credentials. So to think about ways in which citizens' initiatives could be incorporated, I think is a design question. It's something that is part of the input legitimacy of these particular commissions, and is something that requires some innovation and thinking by some groups in order to make that happen, to connect at the global level to local and other contexts. Do you want to say anything, Anneke?
Yeah, I do. I think we touched on this a little in the paper, in that we do talk about representativeness and inclusion, and it is a particular concern from my point of view, with my professional background, also my academic background, that the structures and methods that we use for these commissions or for any other type of advisory body at government level or global level is representative, and they are inclusive, and they are, you know, transparent. and so on. To speak to your point about the citizen-style assemblies and so on, and full disclosure here, I've just come off a contract on this particular forum, but the Universal Health Coverage 2030 is an example of, it's not a commission, it's not a panel. They describe themselves as a movement, and they're constituted specifically to bring in the voices of civil society into global health policy processes. So that could be something that you look at. I ran the research project, the process for their action agenda, and indeed, methodology, in my view, is an important aspect of what we developed, and we did a survey of civil society around the world, and we got 800 responses, which was pretty amazing. So the methods that they employ are very important, and it's important that they are representative and participatory, as you say. I wouldn't say our commissions here were in that vein at all, but it's an important point.
Thanks a lot, Marina.
Thank you. Can you hear me well online? Yes, okay. Thank you. I am a new member of the cluster. My name is Marina Cino Pagliarello. I am a Marie Curie Fellow at the School of Transnational Governance, working with Diane, and I work on the diplomacy of higher education institutions. So this is my topic. Just to add to what Federico said, in terms of input and output legitimacy, US-Europe difference, you are absolutely right, because I do remember watching the panels of the FDA when the Moderna and Pfizer vaccines were approved. And when these vaccines were approved, there was this all-night panel, of course, in Europe with a time difference. And you indeed had all these, experts commissions there asking questions and then, providing in the end, their input for the final approval of the vaccine. Let me go to my question. I found this paper amazing. And as you say, there are different lengths of analysis. And in the end, these commissions, to me, they really look as these, having these polysemantic architectures, right? You have different actors. Some of them are revolving doors actors, others are experts and practitioners and universities. In the end, which I think is also related to the process that, Gabby was mentioning, we read the reports, right? And it seems that, these commissions speak with a single voice. So I was wondering, whether maybe, I don't know, doing interviews or checking the meeting minutes, maybe, if possible, of this commission. In the end, maybe, do you think that we might come to different conclusions? I mean, in the end, these commissions are really these autonomous agents of diplomacy, or there is more a principal agent sort of delegation? I mean, the result will be different with a different process in investigating their role.
Marina, I'm sorry, I kind of lost the drift when people came in and out. So in a sentence?
In a sentence, if we had some, we look at the reports and the commission seems to speak as a single and unitary actors, but they are not. They are, polysemic, different interests. If we had a different methodology, we do interviews, or we have access to the meeting minutes, will be really these autonomous agents of, the diplomatic efforts. So just in the end, a principal agent, delegation thing.
Yeah. Not all commissions present a unified face. And the SACS Commission is an extremely good example of that. The internal divisions were not kept internal, but exploded into the media, severely damaging the reputation and legitimacy of that particular task force, if you like. And it's something that the Lancet has had to work hard on to rebuild its authority in this area for developing its subsequent commissions as well. So you're quite right. I think if we were able to do interviews, we might have got a bit more of an inside sense of some of the tensions and the issues. We were well connected with one of these commissions, and that was interesting, wasn't it, Anneke? Because we're recorded, I'm simply going to say it was interesting.
Fascinating.
And I'm sure
And-
that's
and-
the case for the
And
others.
the least fascinating of all the four, I think, in a sense. I agree. We explored some of this in our paper with the references to the Sachs Commission, what was made available publicly and in journal articles about what happened to that commission and the challenges of some of its findings. So there was 2 points of inflection there, which were not very transparent, but were more from our point of view, just observing that there were internal tensions within that commission. I would say it would be, you know, most commissions, I'm sure, experienced all of those internal style tensions, and how they manage them is the important part of that. I'm mindful, Diane, of the reports of Lord Jim O'Neill, and so perhaps because it was an emergent circumstance, a lot of our commissions didn't put out really detailed technical reports about their methodology or what they did or how they did it. But the Lord Jim O'Neill released a report in, was it 2015, or set of reports on antimicrobial resistance, for example, and he had a lot of, you know, very high quality sub-reports released as well. So these lend themselves to understanding the method and the process that has been used and the integrity of it. Perhaps because of the emergent circumstances, a lot of our commissions didn't get a chance to do that.
Thanks a lot. I don't see it. Laura, please.
Yeah, wonderful. Thank you so much. My name is Laura Ram. I'm also a new cluster member and also a Marie Curie research fellow. So I'm glad to be here in this meeting. Thank you so much. I have 3 brief questions. One relates to the lenses that we are seeing right now on the slide. And I was wondering whether you found that different types that you identified earlier, the different types, epistemic type, official, global commissions, and the civic style, whether, you know, different lenses speak better or are more appropriate to frames of analysis are more appropriate by types. For example, you know, the evidence and roles of expertise would probably be more appropriate for, you know, the civic epistemic style commission. That's my first question. My second one is, do I understand right that these commissions mainly issue reports and publications, or do they have a seat on the table otherwise? And my third question relates to that. It's the question, if they mainly publish reports, can we measure their legitimacy, outcome legitimacy, through co-citation counts versus correlation of their influence? Thank you.
All right, the 3 types, I'll do that one, Anneke, and hopefully you can say something about a seat at the table. It's an interesting question about, depending on the frame of analysis, could you apply them to a different type? Okay, so I'm thinking in a previous appointment that I had at the University of Warwick, they used to have Warwick commissions, and these were primarily composed of academics and scientists with a smattering of a leading public figure of some kind in the area of the report, whether it was on trade or international financial reform, or the last one was on culture. That could have they could have been possibly addressed in terms of an epistemic community framework, which I've not got up there. Or the social learning framework, because what I would say about the Warwick Commissions is that while they were the first of their type in the UK system emerging out of universities, they didn't really have much more than media impact, okay? In the case of the first one, which was on reform of the international trade regime, there was a response from the WTO, okay? But that was probably because the report of that particular commission was reformist. It didn't really challenge the international trade institutions or powers, okay? So it was not a disruptive commission. Whereas if if you were looking at using the paradigm shift or maintenance framework, then that would, I think, apply very well to looking at the Brundtland Commission and taking a more of a longer term historical point of view. So yes, I think you could use those different frameworks for different types of commissions. So the policy advisory framework, the policy advisory systems framework is an analytical frame devised at the nation state level. It would have to be adapted, tinkered with and tailored with in order to deal with global policy making dynamics. And that as yet has not been done. So for the particular beasts that we looked at in this paper, specifically global commissions, I would have liked to have used that framework because it's something I'm familiar with, but it's not yet been adapted as yet to, and maybe I'll have to do it at some point, but you know, it could be done. But yes, that's an interesting question, and I hope it's given Anneke time to think about the next one.
Are you making notes about the papers we're going to write next?
Yes,
Diane, because this one's another one. Talking about publications, or do they have a seat at the table? I think this is a critical area that we've tried to get to in looking at output legitimacy, but making that connection, I think, is important. There's a point in the paper that talks about the various works of Mario Monti since he released his report, and some of the people from his commission, and they're very active in the European space, particularly with the WHO. So I would venture a comment that perhaps they've been more influential in having seats at the table. I think the important thing and the interesting thing that came out of our analysis was the fact that Clark and Sirleaf had to release 2 or 3 separate reports going, what's going on here? Why aren't you adopting our recommendations? And they did that over a 12 to 18 month time frame. So they clearly felt that they didn't have a seat at the table, and that the opportunities were being passed by for the work of the Commission to be picked up in any meaningful way at global level. I think this really probably speaks to the point that we started with in the paper, which was that geopolitical forces or processes, you know, they can be slow and ponderous, and commissions can be formed really quickly, but the translation, I mean, Diane said it earlier, is it an immediate translation for impact, or is it a longer term influence? Well, only time will tell. And maybe what we need to do is reconvene in 5 years and work out whether IPPR's had any long term influence at all. Of course, I think most people would accept that the treaty as it's currently being negotiated may look nothing like the IPPR recommendations at the end of the day, but the notion of it, certainly, you know, it was secured in that report, if not proposed by that panel. The second point you make about legitimacy, I think, is an important one. We found that with some of the commissions, not all of them, 3 perhaps out of 4 of them, a lot of them relied not only on releasing their own bespoke publications, but they relied on releasing journal articles with it as well. It is not always easy to trace where an official publication from a panel or a commission has resulted then in a journal article. But they are the places where the citations and so on get picked up, and the ideas might get progressed. So I think that's probably, you know, in reflection, if Diane and I were to, you know, form a commission to have something intelligent to say on something, the first part of our discussions might be, well, where are we going to put this in a journal? That would be my opinion on that one. I don't know, Diane, I'm setting us up for some future work here.
Yeah, I know. I think there's also something intangible about commissions that's very difficult to capture, and that's the social networking and the next career move of people associated with these commissions. That's something that's kind of important as well, but difficult to capture.
Sorry, I didn't want to interrupt, Diane. Sorry. for that. But Mira, if there's no question online, I think given that we started a bit late, Mira, you want to come in? Yeah.
Maybe I'll hop off
For the mic, exactly. Thanks.
Hi, thank you very much for the presentation, but also thanks to everyone else for the discussion. Kind of picking up on a topic we've been circling around in terms of credibility and relevance and legitimacy with different actors. And I had a question, and forgive me if this is something that you had specified and I haven't grasped it. How were legitimacy and credibility measured in this study? So how was that defined and measured and perceived? And also specifically for whom? So I think just now in the conversation, touching upon the role of publications from commissions going into journal articles. So there you have in the academic sphere. Then there was a mention of the role of commission members being in political spheres. So there's politicians, and we have civil society circling around, but I was wondering, how are we measuring legitimacy or credibility for civil society actors? And that ties into the sort of layered question. Diane had mentioned looking into who comprises certain commissions. And so in your looking into that, what was the actual global diversity of or representativeness of these commissions? If they do come from the sort of general family of big transnational institutions, it's not particularly surprising if they are a chorus. And therefore, what would be surprising is if they are a chorus, but they're comprised of a very globally representative set of experts. And the last thing tying into there, which came from all the comments in the really interesting discussion, is this distinction that a colleague of ours, Mormina, has made between content and context knowledge. And it seems in the pandemic, and it seemed like the commissions bring out a lot of content knowledge in terms of expertise, health policy, and the context knowledge that would come from that civil society space that Anneke was referencing in the universal health coverage sort of outreach to a global set of civil society actors, that context, which would be nurses on the ground, it would be people in maybe the most marginalized spaces experiencing the depths of the pandemic, that might not be there in shaping that expertise. And so, well, my question mark is it there? And if it is there, what does that say for legitimacy and credibility?
The hardest question for last.
Do you want me to start, Diane? Because then I can hand it off to you. Okay. I would just say, in terms of definition and measurement, the paper didn't quite go that far. We used the framework to really just, I guess, make an observation about these 4 case studies. And as Diane said at the start, can we take that further? Is this worth pursuing as a framework for how commissions operate, or they're seen, or they're formed? I think we're heading that way, but I don't think we've quite got to. But on page 3 of the paper, there's actually a table that we did quite early on looking at legitimacy and making some observations about the different forms of commission that we made. And that was really interesting from my point of view, because you know, you could really see, particularly with the input legitimacy, there were quite some key differences that were just coming out from these particular commissions. So I think more work to do in that space. But I want to talk about the representativeness piece as well. This, I think, is really fundamental. And as an ex-statistician, I always look at who's authored documents, who's been included in responses, and how those, you know, how those have been structured into the development of any document. One of the challenges I know from my time in WHO was trying to make sure that the voices in policy development were really representative, and obviously sometimes that's a real challenge when you're working internationally. I can say, and this is public information, so you can go and look up the database yourself and do the numbers. The WHO collaborating centres, for example, there's more than 800 of them, and they are, the majority of them, focused on high-income countries. They have structural elements that often, in my view, preclude low and middle income country participation. We know that there was critique of COVAX even when it started for not being very representative of low and middle income countries in its first iteration, and they had to redress that. So the challenges of representativeness to me are an important aspect of whose knowledge and information is at the table, whose recommendations are getting up, and which perspectives are being excluded either explicitly or implicitly. So we've made that point in the paper, and really I think it's fundamental to how we understand. I mean, we talk about these commissions and so on as being elitist. Sometimes they are, sometimes they might at least make an attempt. I think the IPPR made an attempt to be somewhat geographically representative. And don't start me on gender, because we will be here for much longer than our time allows. But this is a really fundamental question for how global policy and any policy, national policy otherwise, are developed. And I think it's for social scientists, for people interested in transnational administration, for people interested in, democracy and participation, these are the big questions we need to bring to the table. Okay, Diane, over to you.
Thank you very much. I'd like to say you've said it all, but I think one of the criticisms of commissions that I didn't go over, and it's quite a strident one, is that in the attempts that global commissions make in order to be more representative, and it's a difficult thing to do when you're a global commission to be representative. One of the criticisms is, well, it's tokenistic representation, and that those individuals who get appointed to commissions are elites from their own context, and that has to be, okay? For it to be a global commission that's going to get the kind of attention and respect that it needs in order to have some kind of traction with other political and economic leaders, it needs to have a galaxy of superstar commissioners on its board in order to get the right kind of attention and publicity. So there is a real tension, I think, between trying to be sufficiently representative, but at the same time sufficiently high-powered with, for want of a better term, celebrity experts in order to make the commission as powerful as possible. Yeah.
Thank you very much to our two presenters. Anneke, did you want to add anything concluding at that point?
No, I think we've said it all, and I think there's a whole nother session on representativeness that needs to happen, and maybe even a paper in, I don't know, 10 years time now, Diane. I'm looking 10 years down the track. It's an important topic, and it's an important topic for how knowledge is developed and how policy is developed at global level, and it's under-researched.
Absolutely, absolutely. And at that point, I actually thank you for opening up our perspective for the academic year on the two levels that we want to approach it. Number one, insights from your research, and also informing us about the analytical lenses that you applied, and that can help us to gain insight and also to produce evidence on important elements that are there in a very authoritative camp of knowledge production that in a way create the realities that policies then try to regulate. So thank you very much for that. And thank you for everyone for the interest in joining, and also for your tolerance to the overtime that we had, because the discussion was so interesting. We actually will already meet again in 2 weeks' time on 7th December with Tatiana Bayenova talking about European think tanks and their role in EU public diplomacy. That will be very interesting. And actually, we thought it would be good to have it early on next to the first session, so that this wouldn't drown in exactly the momentum would keep and wouldn't drown in the winter break. Fading out of the institute moment. So thank you very much, and hopefully see you all again on 7th December. Thank you. Bye-bye.
Thanks. Bye.
Ciao, ciao.
Thanks. Bye.
Bye.
Bye-bye. Thank you.
Thank you. Bye.